Hello and welcome to this presentation on swallowing difficulties in multiple sclerosis, a guide for caregivers. My name is Erin Delasanti, and today we will be discussing how MS affects swallowing, the role of speech-language pathologists, and practical strategies caregivers can use to help their loved one with MS eat safely and comfortably at home. Multiple sclerosis, or MS, is an autoimmune disease that affects the central nervous system, including the brain and the spinal cord. It occurs when the immune system mistakenly attacks the myelin sheath, the protective covering around nerves. This damage disrupts communication between the brain and the body, leading to symptoms that vary based on lesion location. Some of the most commonly affected areas include cognition, emotions, motor skills, sensation, and vision. MS affects approximately 2.9 million people worldwide, with nearly 1 million cases in the United States. Understanding MS is the first step in learning how to manage its effects. You might be wondering, why is a speech-language pathologist involved in MS care? Well, SLPs work as a part of an interdisciplinary team to help manage three key areas affected by MS. First is speech and voice therapy, as MS can cause dysarthria or slurred speech, as well as reduced vocal strength and breath control. Next is cognitive communication support, as many individuals with MS experience memory, attention, processing speed, and problem-solving difficulties. Lastly, speech-language pathologists assess and treat swallowing difficulties to prevent choking and aspiration pneumonia, and today we will be focusing on dysphagia management with MS. Dysphagia is just the medical term for difficulty swallowing, and it is a significant concern in MS, as studies show that 45% of people with MS unfortunately experience dysphagia. Swallowing is a complex process, as it is an orchestration of numerous muscles, cranial nerves, and neural pathways. Some key neurological causes of dysphagia in MS include brainstem damage, as the brainstem controls swallowing. If it is damaged, swallowing may be slow or weak, making it harder to eat safely. Next is cranial nerve damage. Certain cranial nerves, such as 5, 7, 9, 10, and 12, help with chewing, swallowing, moving food, and keeping the airway protected. If any of these nerves are affected, swallowing can become uncoordinated and unsafe. Next is muscle weakness and stiffness. MS can cause tight or weak muscles, making it hard to move food through the throat and slowing down swallowing. Some people with MS also have sensory impairments and can't feel food or liquid in their throat, leading to a weak or no swallow. Also, aspiration. Aspiration is when food enters the airway instead of going down the esophagus. Swallowing is something we do every day, but most of us don't think much about. But it's actually a very complex process that happens in 4 stages. When someone has MS, this process can become slower, weaker, or uncoordinated, increasing the risk of choking or aspiration. The first stage is the oral preparatory stage. This is where food is chewed and mixed with saliva to make it easier to swallow. The tongue and jaw work together to break food down into a soft ball called bolus. In people with MS, muscle weakness, poor coordination, or fatigue can make chewing slower and more difficult. Next is the oral transit stage. The tongue pushes food to the back of the mouth toward the throat. This stage needs a strong, controlled tongue movement to guide food in the right direction. With MS, tongue weakness or slowed movements can cause food to move too slowly or get stuck, making it harder to swallow properly. Now comes the most important part, the pharyngeal stage, where the swallow reflex kicks in automatically. A small flap in the throat, called the epiglottis, covers the airway to make sure food or liquid doesn't go into the lungs. But in MS, this reflex may be delayed or weak, or the throat muscles might not close properly, increasing the risk of choking or aspiration, which is when food enters the lungs instead of the stomach. The final stage is the esophageal stage, which happens when food enters the esophagus, which is the tube that connects the throat to the stomach. The esophagus has muscles that contract in a wave-like motion to push food downward. MS can weaken these muscles, causing food to move slowly, get stuck, or come back up. Now that you know more about dysphagia, we will be moving on to home education for caregivers and learning ways how to manage dysphagia in MS. As a caregiver, your role is essential in supporting your loved one's safety, independence, and well-being. Proper posture and a distraction-free environment can significantly reduce choking risk and improve swallowing safety at home. To ensure proper posture, make sure your loved one is sitting at an upright 90-degree angle during meals. Also have them sit upright for at least 30 minutes after eating. You also want to provide supportive seating, such as a firm chair with a proper head and neck alignment to prevent slouching. It is also important to create a safe eating environment. Encourage meals to be eaten at a dining table rather than in bed or in a recliner. Minimize all distractions, such as turning off the TV or reducing background noise, so that they can focus on eating. It is also important to recognize MS-related fatigue. Fatigue is common in MS and can make eating more difficult. If they seem tired, prompt them to take small, slow bites or have more small, frequent meals. If eating and drinking become difficult, an SLP may recommend a modified diet to reduce choking and aspiration risk. Adjusting food textures and liquid consistencies make swallowing safer and easier for your loved one. First, we want to encourage foods that are easy to chew and swallow. These foods help reduce choking risk by keeping the texture smooth and moist, making them easier to swallow. You want to try and avoid foods that are dry or crumbly, as they can be more difficult to swallow and increase the risk of choking. On the right side of this slide, you'll see different levels of food textures, ranging from liquidized and pureed to regular food. These textures are a part of standardized dysphagia diet recommendations used to ensure people with swallowing difficulties can still eat safely. A speech-language pathologist will determine the safest level for each individual, making adjustments as needed. Next is the head tilt back technique. This is used if your loved one with MS is having trouble keeping food or liquid in their mouth, chewing, or moving food around. It uses gravity to help food and liquid move down the throat. Now let's look at a video example on how to do this. Have your loved one first take a sip or a bite, and then they will tilt their head slightly back and then swallow. Your speech-language pathologist will tell you when it is adequate for you to use this technique. Something very important to discuss is aspiration pneumonia. This happens when food, liquid, or saliva enters the lungs instead of the stomach, leading to an infection. This is a major risk for people with MS who have swallowing difficulties because weakened muscles can make it harder to keep food out of the airway and lungs. Symptoms include frequent coughing or throat clearing after eating or drinking, a wet, gurgly voice, shortness of breath, fever, chills, or frequent chest congestion. To help prevent aspiration pneumonia, you should make sure your loved one follows their SLP's recommendations, such as modified diets or safe swallowing strategies, make sure they sit upright during meals, and encourage good oral hygiene to reduce bacteria that can cause infections. By recognizing these symptoms early and taking the right precautions, you can help keep your loved one safe. Dysphagia in MS doesn't just affect physical health, it can also impact emotional well-being and social interactions. Many people with MS report feeling anxious or embarrassed about eating in front of others. This can lead to avoiding meals with family and friends and social isolation. Losing the ability to eat certain foods can also increase frustration and loss of enjoyment when eating. As a caregiver, you can help by creating a relaxed, pressure-free environment at mealtimes. Encourage social eating with safe, modified foods so your loved one still feels included. Also, be patient and understanding and never rush meals or draw attention to swallowing difficulties. Your support can help make meals more enjoyable. In conclusion, caring for someone with MS and dysphagia can be challenging, but small changes can make a big impact on their safety and quality of life. You play a vital role in helping your loved one eat safely, prevent complications, and maintain independence. Following your doctor's and speech-language pathologist's recommendations is essential to help prevent aspiration, choking, and other swallowing-related risks. Using safe swallowing strategies and creating a comfortable mealtime environment can make eating safer and more enjoyable for your loved one. Caring for someone with MS and dysphagia can feel overwhelming at times, but you don't have to do it alone. Here are some great resources to help you find more information, support, and guidance. I encourage you to reach out, explore these websites, and connect with professionals who can provide the right tools and support for your loved one's needs. If you have any questions, please reach out to your doctor or get in touch with a speech-language pathologist. Thank you for your time, and I hope you have a great rest of your day.